Hi, everyone. Welcome to our session today to talk about critical care careers. Today, we're going to talk about respiratory therapy program. Um, my name is Cherry. Really warm welcome to all of you. My, I'm the student recruitment coordinator at the Michener Institute of Education at UHN. And today, I'd like to start by acknowledging the land that we're on in which the Michener Institute operates has been and continues to be the traditional territory of Huron-Wendat, the Seneca, and the Mississaugas of the Credit River. Among many other unnamed and unrecognized indigenous communities, Michener stands on land protected by the Dish with One Spoon Treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. We recognize that this agreement is not a thing of the past, but a promise that we honor today and into the future. We share the responsibility of taking care of this land and transforming our personal and institutional relationships. We acknowledge that this is our collective responsibility to strengthen our ties within the communities we serve and practice healthcare in a way that advances the Truth and Reconciliation Commission's 7 health-related recommendations. So, what exactly is an anesthesia assistant? Um, an anesthesia assistant is a highly trained healthcare professional who works under the supervision of an anesthesiologist to help administer and monitor anesthesia during surgical procedures. They also play a key role in ensuring patient safety and comfort before, during, and after surgery by managing anesthesia equipment, monitoring vital signs, and assisting with recovery. So today we are very lucky to have our academic chair, Hasina, to talk to you more about the programs in terms of the program layout, how a typical day look like in the profession, and some advices that she would give to students considering this profession. And over to you, Hasina.
Thanks so much, Sherry. So I'm Hasina Jaffer. I'm the academic chair for our critical care portfolio. I support anesthesia assistants, cardiovascular perfusion, respiratory therapy, and ultrasound. And today it sounds like everyone is interested in the anesthesia assistant program, so that's great. So this is a postgraduate program, which means that individuals coming into our program come from a background in either respiratory therapy or as registered nurses. A key thing that we look for is that you have a minimum of 2 years of experience in a critical care environment. So that means you've worked in the ICU primarily, or perhaps an emerge setting. You have at least 4,000 hours of work, and you're familiar with concepts like mechanical ventilation, all the I guess the drugs or the pharmacology that you would see in an ICU setting. You would need to be familiar with how to interpret arterial blood gases, as well as 12 lead ECGs and lead 2 ECGs. So, those are some foundational skills that we look for. When you come into the program, it's 3 semesters. So, the first semester is all online. There is weekly modules and weekly work that you will be required to do. And there are touch points with the class and with the professor. We have an in-person workshop at the end of semester one. So that's just one day and it's optional. And it teaches you skills such as airway management, how to insert IVs, how to insert arterial lines. And then there's also a 5 day online mandatory residential week that you have to attend. And that's where you really get to think about scenarios and connect with the class. In semester two, the online format continues, so it's all online. And then usually it takes place on Friday, but there's a touch point with the class where it's a synchronous session and you go over a lot of patient case scenarios. So, first semester, you kind of learn things like what do physiological monitors look like? What's an anesthetic gas machine? Introduction to pharmacology and things like that. And I guess airway management adjuncts. And then when you move into second semester, it's all about patient management and case scenarios and crisis scenarios. And then there are 2 weeks that are mandatory and they're in person and on site. We call them residential weeks. So one of them takes place in February, where you'll be on site for a full week, and we run through a lot of sims. Our our lead faculty. Her name is Phoebe Lamb. She's an anesthesia assistant. She runs the week in collaboration with anesthesiologists across UHN. And then there's a repeat of that in April. So there's a second residential week, usually towards the ending of April, or sometimes it falls into early May, just depending on how the academic calendar falls that year. And you need to be successful. So you need to pass your simulations to be able to move to the clinical component of the program. So students come to our program usually with a clinical placement already established, likely through their employer. So that is 12 weeks of clinical that takes place in the OR. And then in addition to your base site rotation, you're required to do 4 specialty rotations. So that's within the areas of peds, OB, cardiac, as well as regional anesthesia. So I'll pause there before I move on to the next question. Does anyone have any questions about the format of the program or what we're looking for in terms of admissions? You can either raise your hand or just type in the chat, and then Sherry will moderate the chat for us. Okay, no questions so far. So I'll just keep talking until somebody interrupts me. And this session's completely informal, so feel free to interrupt and raise your hand at any moment or type in the chat if you have any questions, okay? Okay, so the typical day of an anesthesia assistant, what does this look like? Historically, anesthesia assistants have worked primarily in the OR environment. You work alongside the interprofessional team in the OR, so that would be an anesthesiologist, a variety of surgeons, circulating nurses, sometimes respiratory therapists, and you work in a team environment. The role has expanded over the last couple of years. So a lot of the AAs have branched out to different areas, such as dental clinics. So there's a lot of opportunity there in the dentistry world. Sometimes they work in areas that do minor eye surgery, so cataracts and things like that. And then there's also been an increase, or I guess the government is looking at increasing the number of ambulatory care centers where there's a lot of day surgeries taking place outside of a hospital. And there's a great need for anesthesia assistance in that area as well. If I think back to the COVID-19 pandemic, we also worked in a huge team-based model where AAs actually came out of the OR and they supported RTs, RNs, physios on the floors or in the ICUs because you already have a lot of those skills. And they attended, I guess, protected code blues, so cardiac arrests on the floors and things like that. And in some hospitals, the role has expanded to outside of the OR and into cath lab areas and other areas as well. So what advice would I give to somebody considering the program? I would say that you should definitely spend some time in your own hospital right now, shadowing an AA just to understand what the role is really about. You might want to go into the OR, look at the anesthetic gas machine, and familiarize yourself with that type of equipment that you wouldn't typically see in an emerge or the ICU and just understanding the workflow of an AA, and that'll give you the sense of whether this profession is really for you. I would say the program is very fast paced, so you need to keep on top of the weekly assignments or the weekly readings and case studies. That's very important. And I think that's the bulk of it and your foundational material. So knowing how to interpret ABGs and knowing how to interpret ECGs and things like that. Any questions for me? So I have to admit, I'm not an anesthesia assistant. I'm a respiratory therapist by background, but I have worked very closely with AAs in the past, and it's been wonderful being a part of the program here at Michener. I've gotten to know the curriculum quite deeply, and a lot of the faculty and the anesthesiologists, and they're all wonderful and very approachable. And I would say it's a very supportive program.
Thank you, Hasina. We do have a question in the chat.
Okay.
So there's a question asking about experience or education needed to have before entering this program.
Yeah, so you need to be a registered respiratory therapist or a registered nurse. you need to have 2 years of experience working in a critical care environment, an ICU environment. And once you've accumulated the required number of clinical practice hours, as well as you have to be licensed or registered in the province as an RT, so through the College of Respiratory Therapists of Ontario or through the College of Nurses of Ontario, you would then be eligible to come into the AA program. You're welcome.
Thank you, Asina. Any other question from anyone? Now's a good chance to ask because usually we don't really or we aren't really able to invite our academic chairs to our webinars. So this is a really good chance to ask in-depth questions related to the program. Okay, I see some questions in the Q&A. Can you discuss more about the mission for anyone navigating the process from RT to AA admission?
Yeah, so we changed the criteria. In the past, you used to have 2 years of working experience after graduation. Now, for respiratory therapists specifically, your clinical year actually counts. So if you have 1 year of clinical experience as a student working in the ICU, emerge, rotating through all those areas, as well as 1 year of clinical, combined, if that gives you 4,000 hours, that would make you a great candidate. Um, if you've been out of school for a while and you've been working outside of an acute care setting, we require that individuals applying to the program at least have 4 years of current critical care experience. So if you've been out of the hospital for greater than 4 years, we might need to check in with you on your years of experience and just your familiarity with knowledge and concepts related to medications, mechanical ventilation, and things like that. But usually we do require that you've been in the environment for 4 years.
Thank you, Hasina. The next question is kind of similar. Is it possible to transfer from respiratory therapy to anesthesia assistant?
So no, you would have to complete the RT program or an RN program before entering anesthesia.
Okay, perfect. The last question is about GPA. Is GPA no longer assessed as part of the admission process?
So you know what? Let me look that up. I typically in the past, I don't think we've looked at GPA for the AA program specifically. It's just your experience working in an ICU. So if you're a registered nurse or a registered respiratory therapist, you have that experience already working in an ICU. So you know what it takes to take care of a critical care patient, how to respond to emergencies, how to manage like their vitals, their oxygenation, their blood pressure. If their blood pressure is dropping, you would have a sense of like what medications to give to bring it up. That's the foundational knowledge that we're looking for. So, provided that you have work experience in those areas, you would be a highly qualified candidate. And I don't think we typically look at a GPA.
Perfect, thank you. The next question is about the ratio of RN to RT in the program.
Yeah, so that's a great question. Oh, my landline's ringing. I don't know if you can hear it. Let me just turn off my phone. There we go. Yeah, so in the past, it used to be heavily, I guess the program would have a lot of RTs in it, respiratory therapists. In recent years, we've seen a bit of a shift where we've had more nurses come into the program. I would say both professions do well. They're all successful in the program, but we have found that looking back, the RTs tend to be a little weaker with pharmacology, and the nurses tend to be a little weaker with mechanical ventilation. So in the program, it does cover medications and things like that in depth, but we're looking at developing a basic mechanical ventilation course that we're hoping to have out within the next year or so, and that would supplement nurses coming into our program. So the nurses could take this basic mechanical ventilation course in the future um, to be able to enter the program, and that would support them a little bit better with the mechanical ventilation component.
Thank you, Hasina. One final question. Similar to how the clinical hours from RT count towards AA admission, would clinical hours from working in an accelerated nursing program count?
No, so for nurses, you do require 2 years of working experience post graduation.
Perfect. All right. So all the questions are answered, and we're approaching the end of our webinar session. Thank you again, Hasina, for answering all the questions, and all the questions are amazing. If you would like to connect with our admissions team, here's our email, admissions@michener.ca, if you have any admission requirement related questions. We also have our drop-in sessions every Friday. It's called Ask Michener. From 1 p.m. to 2 p.m., we'll have our recruitment team and also admissions team virtually on Zoom. To answer your questions. We also have our phone line Tuesday to Thursday, and you can call us to ask general questions as well. Um, and before I end this session, I'd like to remind you that we did a series of Michener Monday covering other programs. So if you're interested, feel free to refer to our website or YouTube for those recordings. We also have two more programs webinar session coming. So it's primary care careers. We're covering chiropody, and if you're an international student, we're going to go over international student experience on November 19th. And once again, thank you everyone for attending, and thank you, Hasina, for your time.
Yeah, absolutely. Thank you so much. And for those of us who are still on, I just wanted to add one more thing. Our open house is actually taking place on November 22nd. We will be showcasing respiratory therapy, cardiovascular perfusion, and ultrasound, some of the other programs I oversee. But the space that's utilized is the same as the Anesthesia Assistant program. So if you want to pop in on November 22nd, you'll have access to seeing our anesthetic gas machine, what our mock OR looks like, and I guess just the resources available here at Michener.
Perfect. Thank you, Sina. Feel free to register for our open house event on November 22nd on our website. And we look forward to seeing you all there. Thanks, everyone. All right. Thank you, Sina.
Oh my
Thanks
gosh,
for your time.
my phone was ringing like crazy.
I
Did
saw.
you hear it?
Yeah, a little bit, but that's not very
Okay.
often, so
It's
that's
like, oh
totally
my
fine.
gosh, I have my three kids who just came home from school and
Yeah.
my husband's
Oh,
picking them up to take them to their activity. So he's
right.
calling the house over and over,
Oh
and none
my
of us are picking up
God.
the phone. And I can't even yell at them to say, get out, your dad's on the driveway.
Yeah. Oh
Oh
my
my
God.
gosh.
But
Sorry about
but
that.
no worries. You're right on time. I'm not gonna take too long of your time. But
Okay.
I heard you mention like the rooms are figured out right now. Like you had a meeting with Miranda, so hopefully we can just finalize everything.
Yeah. So we're going to use 803, 805 for
Hmm.
respiratory therapy, but we'll
Okay.
also have 812 open. And
Okay.
812 is where all our anesthesia stuff's located because a lot of the equipment overlaps with respiratory therapy.
Mhm.
So if there are AAs, like they can come by and take a look.
Okay, sounds good. And in terms of the faculty, is there any change or no change to
So
this?
for respiratory therapy, it's Anna and Syra, but
Mm-hmm.
I think Syra has to leave by 12 o'clock, so she'll only
Okay.
be there for the morning. For ultrasound, we have Hiba and Aaron.
Mm-hmm.
And then for perfusion, we have Dorothy and Brian.
Okay, perfect. Sounds good. Yeah,
Okay.
I'll connect with Miranda, and if I have any questions, I'll let you know.
Okay.
In terms of volunteer like reporting, like which room do you want them to go to?
What do you mean? The
Like for like assigning those
student?
volunteers to a different room. Yeah.
Oh, yeah. The students can just go up to like the designated rooms that we said. So like
Okay. Any single one. Okay, perfect. Sounds
yes,
good.
for
All right.
ultrasound, it's 1104,
Yeah.
825, 827 for perfusion, and then
Mhm.
803, 805 for resp.
Okay, perfect.
And then
Thank you,
I'll
Asina.
get to that PowerPoint. Okay. I know I haven't done it yet, but I will I will do that sometime next week.
Yeah.
I'll
Okay.
get that to you.
Yeah,
So
there's still some
that
time for the PowerPoint, so
Yeah,
no
so
rush
that's
with
gonna
it.
be in the auditorium.
Yes.
And is it
This
gonna
year,
be behind me? Like, how am I gonna see it to speak to the slides? I was worried
um,
about that.
Oh, there should be a podium in the auditorium, and then you can read through the slides,
So
from the
normally, like, sometimes they set up the podium, like, right in the middle, and then the slides are behind you and you can't see them, and then other times they set up the podium, like, to the side of the stage, so, like, you can
okay.
kinda glance up at it. So I'm just
I
wondering,
can
like,
bring my laptop so that everyone can read from the slides if that
oh,
works
good, if
better.
it's, like, in
Yeah,
the middle. Yeah, because I was
yeah.
like, "I can't be turning around to look at the slides."
Yeah,
So
no, no, I'm gonna definitely bring my laptop and then
oh,
show it
okay,
on the screen.
perfect.
Okay,
Okay,
perfect.
that's good.
Thanks, Hasina.
Okay,
Thank
thanks.
you.
Bye.
Okay, have a good night. Bye.
Yeah, you too.